Even doctors are misdiagnosing this pain as spinal stenosis, spinal disc compression, bursitis of your shoulder, and even neuralgia. My name's John Van Dyne. This is the Pain Freedom Show, where we talk about muscular problems in the body that can cause strange pain. We're talking about trapezius trigger points, a gigantic sheet of muscle that goes all the way from your neck to your scapula to the back to the middle of the spine. This muscle has 4 trigger points that can be causing you all kinds of pain, from headaches to pain in the angle of your shoulder, neck pain, pain in the back of your skull, pain between the shoulder blades, and pain right next to your spine. We have to talk about these trigger points because it's being misdiagnosed, and people are getting surgeries and taking drugs and medications, and they don't know that the pain can be coming from the trigger points in the muscle. So let's jump right into trigger point number 1. It's going to be right here at the angle of your neck, higher up. You can see it right here if you grab right here. Take a look at the pain referral pattern, everybody. This can cause headaches on the side of your head, in the front of your head, pain behind your ear into your neck, pain in the angle of your jaw, and it can refer trigger points that cause pain in your jaw. So you have to check out this number 1 trigger point. I'm going to show exactly how we get to it. We're going to use this device called a Theracane. Now this gives you the mechanical advantage to be able to find the place where the trigger point is. It's going to be the most sensitive area, and then use that leverage to pull that knob down in. And remember, all trigger point therapy is 30-second hold, ischemic compression. You do that 3 times every hour, at least 2 or 3 times every single day, and you're going to know that spot. Search around and probe, find the place that's the most sensitive. Remember, look for the trigger points to solve the pain before you do anything else. You have nothing to lose. Trigger point number 2 is a little bit further down. It's right in between your scapula, about an inch above the very top of your shoulder blade. So this is how you get to that one. You put the Theracane in the middle of your trapezius, and you look about an inch above that scapula. Take a look at the pain referral pattern right here, guys. This can refer pain to the back of your head. So even though the muscle is right here, you can be having pain back here. All right, number 3 trigger point is right in between your shoulder blade, but it's more at the bottom of the scapula. So this one can refer pain in the middle of your spine, all the way down your shoulder blade, right there. It can refer pain to the angle of your shoulder right here. This is where we're talking about the bursitis. It's not bursitis. We're talking about trigger point number 3 of the trapezius. It's the lower trapezius muscle. This trigger point happens whenever you have people at computers with unsupported elbows, or piano players with unsupported elbows. This muscle gets very angry and aggravated because it has to hold the weight of your shoulder and your arm moving just that little bit, but it's doing work all day long. This can also cause pain at the base of your skull. So this is how we get to it. You have to use either an umbrella or the Theracane. Go ahead and get to the bottom of that scapula. Check out the pain referral pattern in the diagram, and really use the mechanical advantage of this tool. Now you can also get a ball on the floor. I recommend a lacrosse ball or a tennis ball. Or if you have a foam roller that has large knobs that stick out, then you could roll, but most of the time you need something more specific. So I recommend the Theracane or a ball on the wall or the floor. All right, so the last trigger point is actually a little bit higher up, and it only refers pain right to the middle of between the scapula and the spine. It's going to be right in the middle of the scapula, maybe a little bit higher, and you get to it in the exact same way, guys. Find that different area and compress it. Use that ischemic pressure, 30-second hold. Do that every single hour. Now, the trapezius is such an overused muscle. It supports your scapula and your humerus whenever you're moving your arm in any direction. So it also connects to the base of the skull. So guess what it does? It supports the weight of your head. Whenever you're moving your head, if you fall asleep with your head dangling like this, if you read a book and you're looking down, that muscle is connected to the base of your skull, it's holding it up. And it's doing all that work isometrically. Every time you look down at your phone, you're overworking this muscle. So it is no wonder that this muscle gets angry at us, because not only are we using it with every single movement of our arm to stabilize the scapula, but we have horrible posture. Check out my video on how to fix your forward head posture and your hunchback posture, because that's going to help this muscle relax. Get this tool. This is an amazing tool. Get the lacrosse ball. Remember, the pain may not be coming from what the doctor says. They are not trained in musculoskeletal therapy. Check out the trigger points before you assume you have spinal stenosis, spinal disc compression, shoulder bursitis, neuralgia. Your headaches could be coming from trigger points in the trapezius. Do your due diligence. You're worth it. I really hope that this helped you guys. I'm John Van Dyne. This is the Pain Freedom Show. Stay tuned. Take care.